Okay, so here's the heart model. If we think of the heart as a triangle, this bottom point is the apex, the top is the base. So it's opposite of what you think, but think about a triangle. Okay, then you have the superior and inferior vena cava, so we'll have to flip it over to the back. The superior vena cava is coming off at the top. The inferior vena cava is coming off of the bottom. Okay, then we'll flip it back around to the front. And we have the ascending aorta and the aortic arch. Then we have the pulmonary trunk, which is the blue, that crosses the heart, and the pulmonary artery comes off of that pulmonary trunk. The next thing on our list are the three vessels that come off of the aorta, number 13, 14, and 15, and they are actually in alphabetical order. So number 13 is the brachiocephalic trunk. Number 14 is the left common carotid, or the carotid. And then number 15 is the left subclavian. So it goes brachiocephalic, carotid, subclavian in alphabetical order. Next is your right and left atrium. So remember, we look at how it sits in the person who used to have this heart. So this is the left side of the heart. This is the right side of the heart. So this is the left atrium, and this over here is the right atrium. Then the flaps, these elephant ears, are the auricles of the atrium. The coronary sinus, we'll see when we flip the heart over. It's that enlargement right there. And then the opening to the coronary sinus is in the right atrium. If you can see in there, number 58. Okay, so that's the coronary sinus. Okay, we'll leave the auricle open actually, and the ridges of the atrial wall are the pectinate muscles, and where the pectinate muscles end and the smooth wall of the atrium begins is the crista terminalis. Okay, so that's that ridge that separates the pectinate muscles from the smooth muscle wall. The semilunar valves I like to call the pita pockets. So there's a set of semilunar valves here before the pulmonary trunk, and there's another set of pulmonary of semilunar valves, goodness gracious, in here, number 42. I don't know if you can see that in there, blocking the aorta. Okay, the pulmonary veins are back on the outside. There's a set of pulmonary veins on the left side and a set of pulmonary veins on the right side. The interventricular sulcus, there's an anterior and posterior interventricular sulcus, and it's this indentation where this artery and vein sit on the anterior side. And then there's another interventricular sulcus on the back where the artery and vein sit. Okay. Then you have the right and left ventricles. So the right ventricle over here, the left ventricle over here. The coronary sulcus is the indentation where the artery and veins sit across the top. The AV valves, or atrioventricular valves, are the parachutes in here. The strings of the parachute are the chordae tendineae. And where the strings of the parachute attach to the wall, these enlarged muscles are called the papillary muscles. So there's one there, and there are a couple in here on this side. The ridges on the inside of the ventricular wall are called the trabeculae carnae. The wall between the ventricles is the interventricular septum. And our last part is the ligamentum arteriosum, which is this guy right there, left over from fetal development.